So you've already viewed the video on the concept of professionalism. Now we're going to look at the roles and responsibilities. And these are professional roles and responsibilities that nurses can take. So as you can see from this little diagram here, that role of the nurse takes on many different things. And we'll talk about a couple of these as we go along. So it's not just always about being just a patient care provider. We also are teachers. We teach every time we give a medication. We should be teaching every time to somebody that we can, that we're in the room. We advocate for our clients. Remember, it's all you'll learn and get the patients at the center of everything. And our role then is to advocate for what the patient wants, especially if family members are having a hard time not accepting what the patient has chosen. We might be the unit manager. We definitely are collaborators. We can't do our job alone. We need physicians. We need nurse practitioners. I need PCTs. I need discharge planners and physical therapists. So that nurse is kind of like the person in charge of making sure that we've got everything we need. And sometimes that just means going to the health provider and asking for other things. We can be leaders. We can do research to affect change how nurses practice. We're delegators because we can't do it all. And we can be change agents and we can look for ways to always improve the safety and quality for our patients. Well, big thing is we are that care provider. We are the ones at the bedside 24/7. Nobody else is at the patient's bedside 24/7 but the nurse. And we have to have knowledge and skills and attitudes and patience to bring to the table to do all the things, different things we're able to do. One of the things you'll see as part of your professional role and responsibility is be a leader. Doesn't mean you have to be in charge, but when you're the leader and you come up with solutions and you have positive attitudes and you're willing to help other people when they need it, people will want to work with you. People will want to follow you. Managers, on the other hand, are more the boss. And just because you're in a leadership position doesn't mean you're a good leader, but they like to label themselves in leadership positions. Managers, they just tell you what to do. Usually don't ask your opinion and you hope that you work for someone that does. For that leader, you'll follow, you'll take risks, you'll want to again be that change agent looking for new creative ways to do. You might be a change agent. Change is difficult, but doing things the way we've always done them is fatal. I've been a nurse 34 years. Things that I learned in school have changed and advanced and become new best practices. Be part of that person that's always looking for ways to do things better. But change is hard. For some people, they don't want to change at all. And those are hard people to be around, especially in the workplace. You will always be a researcher. Nursing is lifelong, lifelong. You're constantly learning about new medications and new diseases, and you're going to find once you get out into practice, you're going to work in a specialty area. So get out there and learn all you can. Never stop learning. You can't care for patients the way we used to. And again, that's where you might find some nurses, even some educate. We've always done it this way, but it doesn't mean it's the right way anymore. Love this little, according to my research. But a lot of times you are going to get family members that are going to be going to what I love to term Dr. Google. I use Google, got great stuff out there. You just have to know if you're on Google Scholar or anybody's opinion. But you'll get family members that come in. Well, according to the research that I've done on the internet, Don't let them fool you. But then some of them are smart, so listen to. All right, as I said, collaborator. We are a team. Nursing is autonomous. We do have nursing interventions that are independent all to ourselves based on our science. Nursing is an art in its own science, but we cannot do it alone. We need to have a team around us. You will also learn to delegate, which is the hardest thing to do as a new grad. So as you get ready to graduate, we put you into preceptorships where you learn to do that with the guidance of someone working with you. Because as that new grad, and some people just think no one can do it as good as me, I've got to do it all. There's no way we can do it all. So we learn to delegate tasks out to others. Please be the team player. I'm adding this on. I think that nurses forget, we're part of a team. This is one of my favorite jokes. I've also seen this done like the discussion board or school project, but on every team, there's somebody that does most of the work. There's always somebody that has no idea what's going on. Somebody that says they're going to help but doesn't. I just think this is the cutest little joke, and it was a funny movie. So those are the roles. We have lots of responsibilities, and we will be going through those through this course. Nursing has a code of ethics, American Nurses Association Code of Ethics, and that is our responsibility for practice, that we are ethical, that we advocate. It is part of our role, but it is also a responsibility. A responsibility is that we're private. You're going to learn about what, and that is spelled wrong, and I'm so embarrassed. I will change it on your slide so it is correct. But patient privacy in the HIPAA Act that you'll learn about, that you're going to learn about the Privacy Acts and Confidentiality Acts that you even sign as part of our student handbook. That we will have professional behaviors. It is a responsibility that we maintain professional behaviors outside of work as well, that we show caring, that we're prepared, that we reflect on our practice, that we do what we say we're going to do, that we're going to hold ourselves to a higher standard, okay? That we're going to be safe, that we're going to follow protocols and procedures. Those are professional behaviors. We're going to continue to learn till we quit being a nurse. And even sometimes after, you're still reading nursing journals. It is our responsibility to treat everyone with respect and autonomy. People have the right to make their own decisions, which may be very different than our own values or cultural beliefs. But we still have to respect it is their body, their journey. As long as they're informed, support their decisions, which leads to informed consent. That is our responsibility. We don't need to explain it all. Like, if you're not doing the procedure, why in the world would you explain the risk and benefits? But it is our responsibility that patients know and understand what's being done. And if they don't, we call the provider back that's going to be doing it. Or as we're including them in the plan of care, that they understand choices that they make or don't make and what the outcomes could be. And that's a huge part of patient education as part of our role. So as educators, nurses, is a nurse, you're a student, and as a student, you're a nurse, and you're constantly teaching and learning all the time. As I keep telling you guys, I've been a nurse 34 years, and I love going to clinical because I learn something new every day.